This is methylprednisolone, commonly known as Solu-Medrol. It is a corticosteroid, and the way it works is that because it's a steroid and glucocorticoid, it will suppress inflammation, whether it's acute or chronic, and it also can potentiate vascular smooth muscle relaxation by beta agonist. So if you're already giving someone albuterol treatment for trouble breathing, this can help make that response better and help it work more effectively. Pregnancy class is C. Keep in mind that it can cross the placental barrier and cause some fetal harm. I don't want to typically give babies a whole lot of steroids, so keep that in mind. Indications: inflammation of the bronchi, i.e. COPD or asthma, can also be used. It should also be used for anaphylaxis. Contraindications: little bitty babies, fungal infections, and then anybody who has GI bleeding. You want to kind of use caution with those people. Adverse reactions, has a lot of them, but they're typically pretty mild. Can cause euphoria, headache, restlessness, seizures, increased ICP, hypertension, heart failure, nausea, vomiting, fluid retention, hyperkalemia, hypernatremia, and hyperglycemia. But again, like I said, usually those are pretty mild. The main one we might see in the field would be like euphoria or restlessness. Drug interactions, because it is a glucocorticoid, it can raise the blood sugar in the body, so the effects of insulin or something else given to help lower glucose in the body, it might blunt those effects. Typical adult dosage, 125 milligrams either IV or IO. For the kids, 1 to 2 milligrams per kilogram IV or IO. It does take a long time to start working, usually 1 to 2 hours. Peak effects kind of vary, and it stays working in the body for 8 to 24 hours. So it takes a long time to set in, but it also works for a long time. The reason we're doing this in EMS is because we want to get, when someone has that inflammatory response going on with those COPDers that are, maybe end stage or whatever, they've got a lot of inflammation, so the earlier we can get that taken care of and suppressed, the better. And the only real special consideration I want to keep in mind is just avoiding long-term use with this, because it will raise the blood sugar. Just something to watch for, especially with the kids that can't tolerate that as well. You can see someone who's been on steroids for long periods of time, and kids, they might have a blood sugar of 400 or 500, so you can cause a lot of other reactions. But in EMS, giving one dose, not a big deal, should be okay and help out with that inflammation.